for
Sorry
starting the
about that.
recording. We did want to mention that we are recording this, and it'll be available sometime after we do it for other folks who couldn't attend. But I want to thank you for all for joining this morning and for helping with the advocacy efforts around oral health policy in the state of Missouri. If I don't say this later, I want to say it now. Your activity talking with legislators and telling them that oral health has a series of challenges in Missouri and that we can do something about that and that you're interested in it really does make a difference. Our legislators like to hear from community members, and I'd even say they generally like to hear that more than they do professionals or people who run organizations such as myself. So your voice, it may feel a little tentative to you, but it actually matters a great deal, and we've seen the impact from that over time. So this is basically a pretty simple presentation to give you an introduction to how to be a citizen advocate for oral health policy, and I'm gonna walk through things fairly quickly. I do want to encourage you to ask questions as they come to mind, or if you want to wait to the end. I don't think it's going to take very long to walk through this. And I also say that I will be up in the Capitol on that morning, and I'll be available, and I can spend time with you individually if you need that as well. So we're going to do introductions first. I'm Gary Harbison. Melissa is also on here, and then the third staff member with the coalition is Nancy Kettenbrink, who is off doing things related to the conference set up this morning, so she's not joining us. I'm gonna talk about the coalition, give a little overview of that, very briefly touch on our policy goals. Talk a little bit about advocacy, about the legislative awareness event in particular, about preparing, how much your voice matters, which I've already stressed with you a little bit. Just give you some basics about talking with legislators, talk about our priorities, and the fact that we will try to schedule things for you, but impromptu visits are fine. Talk about the coalition one-pager, a little bit of the logistic stuff, and then follow through. And I'm going to tell you what the committees are that are of great importance. I don't have a listing of them here, but when we schedule for you, we'll let you know which committees people are on, but you know, the committees that are probably most important are the House Appropriations Committee for Health, Mental Health, and Social Services, the House Budget Committee, and then the Senate Appropriations Committee. They do not have what's called a Budget Committee. Those functions are done by what's known as the single Senate Appropriations Committee. And then we do have the Oral Health Caucus. There hasn't been a meeting this session. Representative Lichtenegger, who chairs that, is saying there will be a meeting, but we certainly want to let you know who those people are because they've expressed an interest in oral health and oral health policy in particular. So the coalition is a nonprofit advocacy agency. We're a 501c3. We do advocate and we do direct lobbying and what's known as grassroots lobbying as part of our 501c3 status. And that all takes place around the mission, and the mission is to improve the oral health of all Missourians through sound public policy and public awareness. All of our activities are anchored on that mission, and that's what we focus on. And we always ask questions about priorities because there's many things that could be done, but we always go back to the mission. We also have a vision that oral health is a high priority. All Missourians. I think someone needs to mute. I'm suddenly getting an echo. If you could mute, that would be helpful. Anyway.
I think I'm going to go ahead and mute everyone but you for now.
That'd probably be good.
Okay.
still hearing a lot. All right, that seems to have cleaned up. Thank you. So our vision, again, is oral health is a high priority for all Missourians, and that would include decision makers. So with oral health, we constantly struggle with it being kind of extra add-on afterthought, and we work to see a time when that is not the case. And I think we've made a lot of headway in that direction as well. So we're best described as a coalition as a statewide network of advocates working to improve Missouri's oral health through system change. It's important to think of the coalition not of me and Melissa, not in fact just of us and the board, but to think about everybody, yourselves included, as part of a much broader network. And I think that the fact that we have members throughout the state, member organizations throughout the state, really gives us leverage to get things done. Policy goals, I'm not going to spend a whole lot of time on this. This is all of our current overall policy goals. And most of these are fairly general in nature, so a lot of particular things can fit under that. We talk about improvement of MoHealthNet. We'd like to see a comprehensive dental benefit, both in MoHealthNet or Missouri Medicaid. I know some people are not used to saying MoHealthNet, but that is Missouri Medicaid. And we want a comprehensive dental benefit in Medicare as well. You'll see at the beginning of the second column, both of those things. In practical terms, moving to comprehensive dental benefit in Missouri right now, I think, is difficult, primarily because of the budget. We do have a robust limited adult dental benefit in Missouri Medicaid, and it is being used. So some of the other goals: protection and expansion of the public water system, fluoridation. We do a fair amount of work with locals on that, and you'll see we're doing legislative things with that as well. Expansion of access to dental sealants for children with routine dental care. That is ongoing work, and certainly Dr. Dane and the Department of Health and Senior Services is doing a lot of work on that. You'll hear more about that at the conference. I'm sure he will talk about that program, and you'll certainly hear about the preventive services program as well. Implementation of a statewide public awareness campaign about the importance of oral health to overall health. We actually, probably later this year, will be the first time we will do an actual bona fide public awareness campaign per se. That is a goal we haven't been able to work on yet, but we think we're going to get funding, and that'll be a significant, large project for us. So you'll hear more about that later. We are in the submission of the full proposal stage for that, so too early to be talking it up too much. And then the next goal really is about the provider network and the service delivery of dental care for high-risk, vulnerable Missouri Medicaid and uninsured populations, including people with disabilities and special needs. So again, that's that idea of the provider network being broader. And then, of course, one particular way that oral health gets left out is this concept of the medical home. And there is a lot of integrative work being done, but it's something that we have to press for with oral health, like mental health care. It also gets kind of shoved off to the side, and we want to make sure that's integrated whenever there's a project around medical home. So those are our overall goals. A couple of quick things on advocacy. It's the actor process supporting a cause or proposal. So if you say something as simple as we need to do more so that people get good dental care, if you say that to your neighbor, you say that to a representative, a city council person, you are actually engaging in advocacy, something as simple as that. People sometimes kind of mystify what advocacy is. It's at a very basic level. It's simply letting people know that you need something done related to a challenge. And of course, it can be much more specific, and we'll get into that a little bit. Effective advocates influence public policy, laws, and budgets by using facts, the relationships, that's very important, the media, and messaging to educate government officials and the public on the changes bring about. And we'll talk a little bit about that as we go through here. The Oral Health Legislative Awareness event is the only event we do each session held by the coalition where we try to get the general membership joined in. And your visits up there in the Capitol really do matter. Our member organizations take our policy goals up there as well, typically, and that helps push on that as well. And so the more people you can visit and drop in on, the more likely you are to have an impact. It's just going up there and talking things up a little bit, and do it in the way you need to do it. Don't feel like you have to suddenly turn into a superhero or something. Our primary goal really is just to engage legislators as a constituent and as a Missourian. So again, the very simple thing of going up there and saying, I'm a Missourian, and in the case that you're an actual constituent of that senator or rep, I'm your constituent, and I care about oral health, and Missouri has challenges, and we can do something about that. Unified voices, I think the important thing here is unified voices are very difficult to forget and ignore. And, we've seen that repeatedly just simply by going up there and kind of saying the same things. People start getting it, oh, Missourians care about this and they want something done about it. Preparing ahead of time, you want to look up your senator and your representative ahead of time. You'll find a lot of stuff online. You can go to the Missouri House of Representatives or Missouri Senate to find them. You can find their room number, their phone number. You'll get a photo, so that can help you recognize who you're looking for. They'll have a nice bio on there, so you can find out their background. Where did they grow up? What did they care about? You can see the legislation they've sponsored this session, and very important, the committees that they're on. So you can really find a lot out ahead of time by taking a few minutes and just doing a little searching online. There's really a lot of material available, and I urge you to find a little time to do that, especially for your own senator and your own representative. Again, your voice matters a great deal. Legislators like to hear from constituents and concerned citizens. They like to know that you have an issue that you care about. They will listen to you. It is rare. It does happen. Sometimes there's an elected person who really doesn't want to listen, but that's very, very rare. Most people will be quite willing to spend a couple of minutes with you. And you probably should think of your contact in terms of longevity. So you should think, this is a relationship that's not just right about now, but I'm probably going to talk to them later, and they'll remember me that way, and they'll have a sense of who I am and what my issues are, and that'll help them pay attention. So making this connection now can really help later. And if you're doing a repeat visit, you'll find it much easier to have a conversation, and they'll be very open, I think, to hearing from you again. And again, your voice as an individual citizen can carry a lot more weight than lobbyist or professional advocacy staff, even though it might not feel that way to you, especially if this is like a first time that you've done visits like this. It can feel awkward and a little forced, but it really does matter. Generally, when you talk to legislators, just give you some OneonOne guidelines here, and I know there's at least a couple of people on the phone that are really very experienced with this, but just to make sure you get the basics. So you want to say who you are and that you're with the Missouri Coalition for Oral Health. Generally, you refer to senators and reps as, Senator Smith and Representative Jones. Thank you, Senator, for spending time with me. Those kinds of things. Legislators expect to be asked to do something. That may feel a little funny to you. I mean, most people don't go around asking people that they run into for things in a policy realm, but they really expect if you're there, you're probably asking for something, and so that's not to be surprised at all. And you do want to get those asks out if at all possible. The Capitol is a busy place. It's noisy. That's part of what, for some people, that can be a little jarring if you haven't spent much time in that type of environment. And the legislators themselves are very busy, so it's not unusual at all for there to be interruptions. And you just have to wait a few minutes typically. And legislators are human beings, and they may have issues that are completely unrelated to why you're there that they're thinking about. They may just start talking about that. Generally, I acknowledge what they're saying. You have to handle that the best way you think you need to. But generally what I do is I don't really actively engage with them on another issue other than what I'm there. I just kind of acknowledge what they say and then get out what I need to say and move on. If you want to engage with them on another issue, you might try to put a little wall around that in the conversation. So talk to them about that, but then go back to the coalition stuff and say, well, today I'm here for the coalition, and we are interested in, that kind of thing. I think a lot of people, first time in the Capitol, they really want to talk to the senator and they really want to talk to the representative. The LAs, or the legislative assistants, very important people. They are not secretaries. You should never refer to them as a secretary. They're generally referred to with the shorthand LA, and they are. And there's other staff members up there too, especially on the Senate side. You can have other staff. Interns are used in a lot of these offices. You may be handed an intern and feel like, well, why am I getting this college student to help me? But any of those folks can do really an excellent job of making sure your issue is raised and remembered with the senator or the representative. So nothing wrong with talking to them, especially the LA. If you develop a little bit of a relationship with the LA, you bond with them over something, Cardinals, you're both Cardinals fans or something like that. That's great, because those LAs really keep those offices running, and a good LA will help the senator or rep remember that you came by and you were interested in a certain issue. So that's excellent. Don't feel bad if you're sort of stuck with the LA and you don't make it to the senator or rep. That's okay. When we go up there will be committee meetings that morning. They'll go into session about 10. But there'll be committee meetings, so even with an appointment, you may or may not catch your senator or rep. But the LA is almost always there, and they're really good to connect with. They may start asking you questions about stuff, and it's fine if you don't know an answer. That's absolutely fine. Just say, well, I'm not sure about that, and we're going to give you little forms, and you can write on there, Senator so-and-so asked about this, and if it's the kind of thing where they really want an answer on that, we'll do our best to get back with them in a timely fashion and follow through with that. And again, making a personal connection on a personal level is really, really good. You always want to be polite and thank them for their time, even if they've been distracted during the whole time. Generally, you'll leave 2 pieces of paper. We'll have a OnePager that's over, covers the coalition and our goals. It basically says we have oral health challenges. The coalition is here to try to focus on our mission and change that. We've got these priorities, and on the backside, you'll see a bunch of logos, which really is the organizations, some of the organizations involved in us, and it helps generate leverage. You'll leave that 1-page overview, and then we'll have another sheet that's just a little bit about our legislative priorities. This year we'll be on the 3rd floor rotunda on the Senate side. It's always noisy up there, and I'm not quite sure what sort of seating we'll have, but that's where we'll be. So up on the 3rd floor in the rotunda, there's a big open area out there. We will have a place out there on the Senate, our eastern side of the Capitol building. So our priorities, we have had some things that are relatively vague on here, but we have a couple of pieces of legislation that are floating that are relevant. The bottom one there, House Bill 1617, we didn't really stimulate the production of that legislation. And actually, to be honest with you, when I first saw it, I was concerned about what it's doing. This was filed by Representative Jay Barnes, that's here in Jefferson City. He's a very competent legislator. And this is really some cleanup related to telehealth, and it will actually help make telehealth and teledentistry that we support and are interested in because it's an access issue easier. It'll make it easier for that to happen. So we do want to support that bill. It's a no-brainer for us to support it. And so where that bill is, 1617 has already been through the House and passed, and it's been first read on the Senate side. Generally, legislation has to go through both the House and the Senate. This one's already been passed by the Senate and moved on. It's been in park over there for a while in the Senate, so I don't know what its chances are. But it's worth saying, please pass House Bill 1617. We have some fluoridation legislation. We did ask for this to be filed. This has been filed by Representative Lichtenegger, House Bill 2213. So we have passed a bill in a previous session about requiring local, and we'll have information on the priority sheet about this. And of course, I'll be there to answer questions as well. But a lot of times the local decision-making body for fluoridation, and it's very much a local issue in Missouri, was not giving any type of notice before they cut off fluoridation. So we passed a bill for that, and it's been in effect. That was also filed by Representative Lichtenegger. But we've seen some problems. So this bill would simply require the local decision-making body to get information about public water fluoridation from their local county health department. Again, kind of supporting local decision-making. We don't want to do anything to try to take that away from people. It's very much a local matter. But we found since the notification legislation came out that there are entities that are completely autonomous. They don't want to talk to anybody else, even other local people. And we certainly think the county health department is charged with taking care of public health, and they should have something to say about that. We know the Department of Health and Senior Services and the Office of Dental Health, and Dr. Dane, our dental director, will provide training on this function and really keep the burden to local public health minimal. So you want to ask them to support that. That bill has been filed, first and second read on the House. I didn't check this morning, but I do not believe it has a committee assignment as of yet. So there's plenty of reason to be asking people to support that legislation. Our most important thing to push on, though, is to continue to fund Medicaid adult dental benefits. We got that reinstated in 2016. We know from Dr. Dane that thousands and thousands of people are getting services, many for the first time in many, many years. So that is helping, and it's helping curb the use of emergency rooms for non-traumatic dental issues. Our main message this year, as in last year, is to say thank you. Of course, with reducing state revenue that we're seeing, it's always a concern that it'll be trimmed out of the budget. It's an optional Medicaid service that the state does not have to offer. There's nothing in the Medicaid program that requires them to do that. So we want to be sure and say thank you. We are hearing that it's expected to be funded. We're hearing a lot of support for it, but we certainly want to push on that. That's the biggest thing legislative that we have accomplished, and And so again, there'll be some information on those one pagers for you that you can leave with them. And again, you don't have to be an expert to the nth degree on all of these policy issues. You just want to go in there and say thank you for continuing to fund Medicaid adult dental. It's important and it's making a positive difference for people. And they can read those. They can read through those sheets. So just in terms of scheduling, Melissa will, if you have provided your full zip code, you will be scheduling appointments for your senator and representative, unless you've said you will take care of it. We do have folks on here that are old hands and folks that will go to the legislative event that are old hands with this stuff, and they'll take care of that. But we'll be scheduling that. We'll have that schedule up in the third floor rotunda, and again, you know, you may still miss your senator or rep even with the schedule. And again, you may get time with the LA or a staff or intern, and that's great. It's not unusual, even with a scheduled appointment, to go up and you find the door to their office locked. You know, just come back. You have to be a little persistent. Wear good walking shoes because there's a lot of walking in the Capitol. You'll be primarily, I think most of the time you'll be up on the third and fourth floor, but you certainly could be down first and second as well. And we'll give you some information about elevators. There's stairs. If you want to get your steps in that day, you'll be able to do it. I will tell you that occasionally an LA will, so if you go past 10 o'clock and they've gone into session, an LA will say, look, I'll go pull the representative off the floor. They will do that. Generally, you'll be going with the representative, and they'll tell you where to wait. It's outside of one of the side doors typically. If you're lucky, they might pull you into the side gallery on the main floor, which is kind of an interesting view that most people don't get. I personally wouldn't press for pulling them off the floor. You can do that. Those conversations are just a little bit more chaotic because they're out there in the hallway typically. But if the LAs, a lot of times they'll go, oh no, we knew you were coming. We're going to go do that. I'm going to go get the senator or the representative, and certainly let them do it. Go with the flow. We may schedule you with other senators and representatives, based on who's on an important committee and who's on the oral health caucus, other than your own senator and rep, just to make good use of time. And I want to say it's also okay to just walk into. I'm sorry, the phone's ringing. I don't have a good way to mute that ringer. But it's fine to walk into another legislator's office and speak with a senator or representative. You want to be especially polite if you walk in completely unannounced, but that's not unusual too. Depending upon what kind of day is up there, there may be other groups with lots and lots of people with them. That's not unusual. That's another way the place gets really noisy. I mean, sometimes there's schools making school trips up there, and there's kids all over the place. Sometimes other groups are up there with lots of visitors, and so people that work up there get kind of used to people coming and going, and so it should be if they're too busy to talk to you, they'll let you know. So no harm done. So the coalition one-pager, again, that's a brief document. It can be left with each office. It talks about oral health is an important policy issue. Oral health is poor in Missouri. It can and should be addressed by policymakers, and is of an interest as a policy issue to many organizations and individuals. Again, those logos on there show this is just not a single organization pushing on this. This is really a lot of people, and those logos draw attention. So this is a map, and we'll provide you of maps of all the floors of the Capitol building. That'll be up, and you'll just have to get to that third floor rotunda on the Senate side. But this is a map of the third floor. So that big circle in the middle, that's open. You can look down to the other floors, and we'll be somewhere around that red X. We don't know exactly where our position is, but those are the two kind of formal entry doors to the House and the Senate. They're off of that rotunda, so there's some rather large, grand doors over there, and just come up there, and I should have at least some signage up there. I'll be standing up there, and hopefully you'll be able to find me fairly easily. Again, there can be a bunch of other groups up there. It might be really noisy. Unfortunately, we've used these alcoves by the stairwells before. Those are a little bit more private, but still really noisy. So it's not, wherever you get in the Capitol, it's pretty loud. I like the third floor because you're closer to where you need to make your visits. There are rooms sometimes we can get way down in the basement. I don't really like to do that because then you gotta hunt for that. If you don't know your way around the building, it can be a little challenging. Third floor you're gonna have to go to anyway, and so we'll get you up there and get you started. Parking can be very challenging near the Capitol. There's metered parking on the Circle Drive. You got to watch those signs really closely. There is some free 3-hour parking in the Circle Drive. There's not much of it. It's generally used up and hard to get one of those places. A lot of the parking in and around the Capitol on the adjacent streets is 1 hour only. That's not going to be enough, and the tickets are not high, but they issue them regularly. They will not mess around with that. Those little meter carts go around all the time. If you look, you'll see them, and they generate quite a bit of revenue. And I would urge you to not set yourself up to make a contribution. Ideally, you can walk up from the Capitol Plaza Hotel, and obviously you can park for free down there. Even if you're not staying there, you can slip in the parking lot. I don't think they're gonna catch you. It can be pretty crowded down there. They do have a parking garage in addition to parking all around the building. It's a little bit of a hike up the hill, but that's a much easier option than finding parking. As an alternative, there is a parking garage on Madison Street at East Capitol. You'll have to pay a little bit for that, a little bit more than you would at metered. You can park in there, and then you've got a couple of blocks to walk down to the Capitol. Not a bad walk that way either way. You will enter the building on the doors under the stairs on the south, essentially the south side of the building. So High Street is that main street there that runs between the Supreme Court building, some other state office buildings, and the Capitol. Opposite the river side, and the stairs are the big stairs in the front you can see, and you actually walk underneath there. You do go through security now, very similar to airport security. You want to give yourself a little extra time to get through that. If you happen to arrive when a truckload of kids is going through there, you'll definitely have a little bit of a wait, but I think that time of the morning, typically, you're not going to run into large groups. Once you get through security, you can find elevators near the ends of each hallway to your right and left, and there's even one, if you go straight through the rotunda on that main floor and go back, there's an elevator along that back wall. That's a little bit harder to find in practice, but there's elevators to your right and left. You just have to kind of walk the corridors and watch out for them, and you'll find them near the ends of the buildings. You can take the stairs, of course. Once you get out of security, you'll kind of make a U-turn to the right or left. You'll see stairs, and you can work your way up to the higher floors there. There is an information desk that you'll see when you come out of security. They can give you information on finding anything. If you could, just get their attention, and they'll tell you where the elevators are and how to get to the third floor rotunda and all that if you need assistance. I will be up in the rotunda at least by 7:45. I try to be there earlier than that, depending upon how long it takes me to get through security and all that kind of stuff. I'll have the schedule of appointments, building floor maps, the 2018 legislative priorities, the coalition overview. We have a little advocacy kind of one-pager thing. I'll have that available up there. We have feedback forms for you to write down, who you visited. Very important for us because we want to know who was visited and how many. And of course, if you have any questions that you got that you couldn't answer and they want follow-up, that's the way to tell us. You can give that, ideally turn that into the conference check-in desk when you come back down to the check-in desk at the Capitol Plaza Hotel. There'll be a little break in there, so you'll have plenty of time to get down there. Lunch doesn't start until noon. We usually, things start to wind down around 10 because they go into session and you have an increasingly hard time catching anybody. Again, the LAs are generally there and not a bad thing to do. We do give a little thank you to people who participate in the legislative awareness event, so be sure to mention that at the conference check-in. They are supposed to ask you if you were up at the event, but if they don't, be sure to mention. I just came back from the Capitol. Follow through. So again, get those legislative feedback forms in at the conference desk and pick up the thank you I mentioned. Personal follow-up thank you notes make a great impression. These folks get emails all day long. They get phone calls. Handwritten thank you notes are a little unusual, and I know it takes a little bit of time, but if you can do a little note, that will help them remember that you were there and you were there about oral health. So just a little note. Thanks for taking a few minutes with me. It was great to talk to you, and I appreciate all your work on oral health. Something that simple would make a big difference to folks, and it's a really nice, I think, a very nice touch to do. You can get their addresses again on the House and Senate websites. On the address, you want to follow this format here. The Honorable Senator John Adams, and then you can get the rest of the address off of the websites. They are formatted a little differently from year to year, we found, but it's fine. And if you get through this process and you have questions, just send it to info@oralhealthmissouri, and one of us will respond to you. And you can send questions there if you have questions that you don't want to bring up now. Also, we'll be getting and as we mentioned, this will be out available. This webinar is recorded and will be out available, so you can run through it again if you do that. And then we will also send you a webinar survey link for just to folks who attended today, and we'll include a few questions in the conference survey about the legislative event itself. So with that, I'm done with the formal part of my presentation, and I'd love to get some questions from you all if I wasn't clear about anything, or you just hit me up about something. If I missed anything, this would be the time. Hopefully Melissa can unmute everyone and we won't get crazy echoes.
Yes, that's what I'm doing right now. So if you have a question, please ask. You can also type it into the chat box.
This is Linda Hoffman. I just kind of came on late. Sorry I wasn't able to be at the beginning. And so you said this has been recorded, your PowerPoint. So when will that be up on the link? And where do we go? Just go to your website and look for the link to get the first part?
I think Melissa will send we'll have to figure out how to post it, and Melissa will send a link to you an email. Isn't that correct, Melissa?
Yes, I'll send an email out just later today with the link to the recording, and then also to the webinar survey, evaluation survey.
Yeah.
Okay.
Yeah.
And you'll and go ahead.
I was going to say I'd be glad to answer any questions you have now.
Well, and then too, this is Linda again, you're gonna have all the papers we need, you said, right, up there, so we don't need to
Yeah.
make copies or anything. Okay, great. Okay, thank you.
No, we'll have all that prepared for you, and hopefully have it nicely organized where you can get up there and
And Gary, this is Diane again.
Yes.
I just want to say, yesterday when we went to the Capitol, the Senate had a lot of committee meetings in the morning, and they didn't go into session until 2. I don't know what it's going to be like on that day, but that might be something to consider and ask when when you're scheduling appointments, how to best get around that.
Yeah, we probably, Melissa's going to be calling for those appointments, and I think we probably will avoid scheduling past 11 or so. But that's a very good point, Diane.
Yeah, they just changed it.
Yeah, those schedules, they flip those around. And this session, they have tended to do pretty intensive committee work first thing in the morning, and I have seen them delay start of session. So yeah, it's more typical to go into session at 10 or 10:30, but that's not necessarily going to happen, and we may find that they're a little bit more available later. So yeah, again, kind of have to go with the flow. Thanks for bringing that up, Diane.
Sure.
Hi,
Diane,
this is, okay, go ahead.
I was just going to say Diane knows far more about this stuff than I do. Anyway, go ahead.
Hi, this is Abia Oka. For those of us who live in Kansas and are not actual constituents, can we be paired up with somebody who has a representative or not?
I think we can. Melissa, do you think you can take care of that?
Yes, if you can email me what the zip codes are, maybe of your service area, so where you're possibly seeing patients, then I can pair you up with those legislators.
Sure, thank you. I'll do that.
Yeah, so you probably would introduce yourself as a person who serves people in Missouri in certain
Yes.
areas.
Yes.
Yeah. And they'll listen to you for that purpose just as closely as if you were in their own district. They know that you know things from working with their constituents, so they want to hear that too. So
Okay.
good question. Any other thing I can address? All right. Well, again, feel free to send questions to info if something else occurs to you after we get off of the call. I've tried to be pretty clear with this. I think, to boil it down in real simple terms, it's kind of like talking to your neighbor over the fence. You want to get along with them, and maybe you need something from them, so you're nice to them, and it's nothing really all that more complicated than that. Now, granted, a lot of these people know a heck of a lot more about policy than you're apt to know, but that's okay. They can be that expert. You can still express your interest, and if they say, well, how would you fix that? And you don't have an answer, say, I'm not sure, but I'm sure we can come up with something. Don't worry about not having all the answers. You may also find they follow up later. For example, they may go, oh, you're a provider in the Kansas City area. Well, I'm going to call you, and they may get a hold of you later about some other issue that they're interested in. That happens, and that's okay. That's a good thing. So you may have conversations with them after meeting them. That's good. All right. Well,
Gary, I've got another question. This is Linda Hoffman.
Yeah.
Okay, so what happens if you get sick you're not able to attend the event? Who should we call if something last minute happens or it's terribly icy and you're not even going to come? I mean,
It is
do you have
Missouri. It could happen. Yeah,
That's right.
Try to let us know as soon as possible.
Well, who do we contact, or what's the phone number or whatever? I mean, who do we just?
I think the best thing to do would be to send an email to info@oralhealthmissouri.org. That morning, Nancy will not be here. There'll be nobody in the office, so there won't be much point in calling calling the office about that. You can text me if you want to text to my personal cell phone, but I will tell you, typically it gets pretty busy up there, and I don't necessarily get a real fast time where to look at that. So info is probably a little bit better in that other people will be able to look at that as well. And you know, if it's really truly last minute, it's last minute. Things happen, and you know, ideally we'd let people know, hey, they're not coming. But you know, if we can't do that, we can't do it. I mean, people have wrecks, people get sick that morning, and can't do things. And you know, don't sweat it. Try to drop us a note. We'll do what we can about it, and don't worry about it. Hopefully the weather will hold for us by then. We're hoping we don't have weather issues. We've been lucky every year we've done this with weather. It's always kind of dicey, but we have been fortunate. All right, good questions. Anything else come to mind?
Well, this is Linda again. Since I was just there yesterday with Diane lobbying,
Yeah.
bring in your business card, especially the person from Kansas. And she's, you know, I mean, it's nice for them to have your information. So bring business cards so they can contact you. You know, bring your
That
own
is
person, you know, from your work or whatever, you know.
that is a very good suggestion. Yeah. And I will have some of my business cards up there, and if you know, you can leave my business card with them as well if you want to do that. I'll have a little supply up there on our area. We should have a table on the rotunda. I'm certainly hoping we do, and at least a couple of chairs, and I'll have business cards out there as well, and you can drop that up. But yeah, that's always good to leave them your contact information if you have a business card. They like getting that. Makes it easier. All right. Well, Linda and Diane, what have I missed? You guys have done this a lot.
It looks good, Gary. Thank you.
All right. Well, I think we'll have a good impact. I think we're going to have a great conference, and I really appreciate you guys going up there and being participatory in our government. It really does make a difference, and I think you'll find it an interesting experience. If you've never done it, you'll probably come out with the ability to brag about it. And we will try to recognize you at the beginning of the conference for doing this. It's not everybody that's willing to do this, and we really appreciate you getting up there. We typically have completely new members do this who have never done this type of advocacy work, never talked to a legislator, and I think that's great. That always makes me happy every time we see that somebody has learned, oh, I can be an active citizen and I can engage with people and make a difference. So we hope to see that. All right. Well, I think we're gonna cut it off there. I thank you all for hanging in there with me this morning, and I look forward to seeing you in a couple of weeks.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.